Mentioned the malignant nerve tumors before. I wanted to go through a little bit about what our process is for dealing with those. Remember, these are tumors that tend to be painful, not just painful when bumped, but just spontaneously painful, radiating pain down the extremity or affected body part. They can be rapidly growing. They can have numbness or weakness, have irregular margins like we talked about. So if we see that, we don't just go right to surgery. We want to get a tissue diagnosis first because different types of tumors that are malignant can have different treatments. And so it's important for us to figure out exactly what type of tumor it is. And we usually get something called a CT PET scan. It's a CAT scan that actually has this functional component to it where they inject radioactive glucose, sugar, that's metabolized by the malignant cells, and it shows up bright in the malignant area. And what's useful about that is it tells us in the tumor where the malignant cells are, so we know where to guide the biopsy needle. It also tells us if the tumor has spread or metastasized to other parts of the body. So your doctor may talk to you about getting a CT PET scan before doing the biopsy or doing any other workup. Once we have a diagnosis, if it shows to be cancer, then that's a bigger operation where we normally sacrifice the nerve that gives rise to the tumor. These are big operations, generally with a surgical oncologist, a big surgical team, complicated surgeries that, we don't take lightly. But sometimes those surgeries are necessary to get the tumor out without having that tumor spread. And so time is important. So if you have something that you think might be malignant based on some of the features, you definitely want to reach out for medical care because the longer you wait, there's a chance that tumor can spread. Now, benign tumors don't spread. And again, this is not something you should probably be deciding on your own. It's something you should really talk to a healthcare provider about. But if it does end up being a malignant peripheral nerve sheath tumor, and you'll see the term MPNST sometimes, these tend to have a high morbidity and mortality. What morbidity means is when you take out these lesions, you usually have to take out the nerve and the surrounding muscles and sometimes the blood vessels with them so that you can cure the cancer, okay? So sometimes these have a high mortality, right? These can be dangerous surgeries. They may be locally recurrent. The tumors can come back locally. They can spread along the course of the nerve, or they can metastasize despite resection. Here's a picture of a CAT scan showing a metastasis in the patient's lung. Now, the survival for these tends to be low for the aggressive malignant peripheral nerve sheath tumors. Only about a fifth of the patients survive after 5 years. So these are, scary lesions. But again, rest assured that the overwhelming majority of peripheral nerve tumors are not malignant. This is not something you'll likely ever have to deal with. It's just, I add it to this talk for the sake of completeness, or in the very small percentage of viewers who may have symptoms like that. I really encourage you to reach out for medical care earlier rather than later.